So thanks everybody for joining. I'm here along with Dr. Jennifer Williams, and we are hosting the second webinar in our series, which is therapeutic presence and co-regulation. And super happy to have all of you here and to be hosting this webinar. I think we're going to do a little poll. So I don't know, Azalea, if you're going to pop it up now. Yep. So if you'll just take a second and respond to our poll, that would be super handy. We would love that. And I will thank you in advance. Appreciate it. Awesome. All right, so while we gather that data, I'm just going to go ahead and move along to take care of a little bit of business. So I'm not sure if this is your first time in our series, if this is your second time attending, but this is our second webinar. And we launched this series because we were really interested in having a place where we could start to talk about trauma responsive practice by tuning into some of the small little like nuggets of practice that were relevant to Jennifer and I, and that we found really relevant in our practice, but that often didn't get a whole lot of time devoted to them, or they were swept in under some big topics. So that was one piece. The other piece was really just to start springboard some clinical conversations, right? This is the start. We hope that after today's hour, you'll spend some more time thinking and talking and using some of the resources. And lastly, I think this is our way of just adding to the growing community of trauma responsive practitioners in the area, lots of diverse expertise. And we just wanted to be part of that community and build that community in the way that we could. We have the QR code if anybody, obviously you're here, so you found a way to register and join. But if you want to learn more, just remind yourselves about what's upcoming, access some of the other webinars, just have it handy. Make sure you scan that. The last webinar is already posted, and this one, I think it was like a week, so or maybe even less. So you can have this webinar, and the resources will all be up there within a week's time. I wanted to also take another moment to give a nod to sort of our larger programming. This is a piece of our trauma responsive programming, something that Jennifer and I have launched and we're really excited about, but it's part and parcel of Barry University's social work education, which is really rooted in a trauma-informed lens, both at the BSW and master's level, and then our doctoral program, which is a doctorate in social work, so a DSW. And that program, and I know some of you are here that are part of that program, I saw you, and others aren't. But if you want to learn more about being part of this community of advanced trauma practitioners, advanced trauma social workers, please scan that code, learn more about our program, ask questions, reach out to our director, find out what you need to. So thank you for that. And I will move along to the other bit of business, which is introducing Jen and I. So some of you might know us from classes or from the other webinar, or from other things. I am Dr. Ashley Austin. I use she, her pronouns. I do a lot of work. I've been at Barry for like over 15 years now. Jen and I have a lot of similarities in terms of time in the field and even time at Barry, which is kind of random, but we also have a lot of differences. And I thought that was something that we liked about this, is that we were going to bring you, we're both trauma responsive practitioners. We do a lot of work and we do some things really similarly and some different. We wanted to sort of invite you all to think about sort of what your work looks like within this broad context of trauma responsive practice. I am an EMDR therapist, and I do other sort of trauma, sort of other parts of a trauma treatment sort of inform my work. And then I happen to work primarily and quite for a long time with the trans community, trans and non-binary children, teens, and adults. So a lot of my practice experience for at least the last 10 plus years has been around that area of work and area of focus. But also a lot of the concepts that we think about apply to clients across the board. So we want you to think about your clients and how the work that we're talking about fits in with your population and your area of expertise. I will turn it over to Jennifer for a moment so she can introduce herself and welcome you all here as well.
Yeah, thanks, Ashley. And thank you, everyone. So happy to see so many of you again back here in this live webinar. Very similar. My area is in the mind and body connections in specifically in the neurobiological components to that. I do have a private practice. I've had it for more than 2 decades and really specialize as well as an EMDR therapist in trauma responsive practice, which we'll talk a little bit more about today, about why that's therapeutic presence is so incredibly important, not only in all the clinical work that we do, but especially when we're working with trauma. And so I'll talk, we'll have a little discussion a little bit more about that later. So thanks.
Awesome. Thank you, Jen. So you can learn more about us. I think our bios and various things are on the Berry website and in different places, but hopefully you'll get to know us better as we do these webinars and see what we're really about clinically when we do this kind of stuff. So today's webinar, Jen sort of nodded to it, is about therapeutic presence. Therapeutic presence and co-regulation. So we're going to focus on sort of like how this shows up in our practice, why it matters, how it's a part of this work, and then start to really look at the strategies. Like, okay, so if it's important, what do we do? So trying to make this really sort of practical. So happy that you are all here to begin to think about this little tidbit. Want to give a nod to the people that have been making me interested and excited and inspiring me lately. Not an exhaustive list. A lot of these folks you'll see are focused on what Jennifer was saying, sort of, right? Mind-body connection, neurobiological components of healing, so polyvagal theory, and some are clinicians that do EMDR work. Some are leaders in trauma from the beginning. And I always think I get to be a little bit of a fangirl for certain people at certain times when I'm just reading something and it just really resonates, it really gets exciting. And so these are some great people. Sherry Geller is someone who does a lot of therapeutic presence work specifically, like very specific, that language, that topic. These other folks do like broader work, but they talk about, or they invite in this conversation of presence in their different intervention work. And I have found all of them to be really, really helpful and interesting. And so I strongly encourage you to look into all of them if you haven't yet. And they're on some of their great stuff is on the resource list. So, okay, all that. So why we're sort of saying it's so important, why focus on it? So I'll say a couple things, right? Like, so Jennifer and I just both said that we are EMDR therapists, and we are, right? This is what we do. And there's other evidence-based trauma treatments that exist that some of you might be really sort of specialize in or do. There's other work that we do sometimes that's not EMDR, then we're doing other aspects of trauma work. And what we know is that regardless of the intervention approach that you're using, whichever the intervention is, the evidence-based intervention, that common to the success of each one is the therapeutic relationship. And we know this because the research, we know this because it feels intuitive, and we know it more because the science actually tells us so. There's been lots of studies looking at that and finding like let's look like the common factors, these core ingredients, and therapeutic relationship is one of those things. And we think about therapeutic relationship and you'll look at that, there's like a million definitions and it's big and it's broad. Therapeutic presence is foundational to therapeutic relationship. And I think it's something that doesn't often get discussed a lot, but when Jennifer and I were thinking about like neuro-informed practice and trauma-informed practice, like what does that mean? For us, this therapeutic presence piece was really, really important and we didn't want to overlook it. And I think that it gets ignored a lot. Like who's talking about it? How much do we really understand about it? Where is it really showing up in articles and papers? And that's why I want to sort of give this huge nod to Dr. Geller, because she is talking about it a lot and sharing it, but it really should be in lots and lots and lots of different trauma responsive conversations. And the absence of therapeutic presence can actually cause harm, right? So it's really helpful to the work, really promotes opportunities for healing, and the absence of therapeutic presence can cause great harm. And so we're going to sort of think about that, look at that, sort of spend some time with that as we sort of then think about like, okay, so what does this mean for us in our practice, right? So we want to be the ones talking about it. Okay, and thanks for the poll. Good timing, Azalea. We can see that most people are not very, very familiar with it, which is possibly why you're here. So welcome, and I hope you will feel very much more familiar after today. Some folks know some, but not a ton, sort of split between, medium and somewhat familiar, and then some not at all. So Great. This is the perfect, we were in the right place, right? No one's wasting their time. Glad to know. So I've told you why we should focus on it. We know, based on the poll, that you're not totally familiar with it. So we'll talk a little bit about what it is in a second, right? So we think about, and I think one of these things, right? Like thinking about Judith Herman and other folks, right? Safety is fundamental to trauma work, like safety, safe space, safe relationship, really, really important. And that safety of therapeutic relationship and the effectiveness of our intervention is really rooted in us, right? Like we are the person in our relationship with our client that creates that safety, right? And so as we think about the work, you might have the best intervention in the world, but we are the instrument. We are the instrument through which the work is done, right? Like us, the human being. And so being present as we get into what that is sort of helps us figure out like, oh, okay, we are the key to creating that safety. And one of the ways that safety happens is our presence, right? And so I want to give an example of what it's like when we're not present. Sort of an example. We'll get to what therapeutic presence is, and it's like the whole webinar, but I want to start by saying, this is what it's not. And I want to tune into this because if we don't know what it is, it's going to be really hard for us to be that, do that. And so this is an example. So bear with me while I read it. Oh, bear with me while I change the screen. But bear with me while I read it. And I got, so just an FYI, I went onto the internet and I got this from Reddit. I was really curious to think about like, what are clients saying? And the fact that this was on the internet and someone was sort of looking for help on the internet was extra concerning, right? Like help with their therapist from the internet. I have been seeing my therapist in private practice for over 2 years, primarily for an eating disorder, and I really like her a lot. It took me nearly 2 years to open up to her because, as my history has shown, people aren't trustworthy or safe. So I don't share or say the hard things. During our time together, she's texted here and there during appointments, but not to the point where she hasn't been able to follow the conversation or keep everything straight. Not the greatest, but not bad. One day she even asked me to hold on a sec while she messaged her son about a few things. Recently, I've been feeling nothing, no emotion. I told her this 2 weeks ago, and then again last week, and she acted shocked and asked how long it had been going on. I told her we talked about it the time before. Today, she didn't even ask me about it. She was on her phone a lot. So much that she just said, that's crazy, then repeated the last phrase of what I had just said while texting more, and then I just shut the hell up and stared at her. When she looked up from her phone, she just started talking about eating 3 meals a day like she was picking up from my last comment. Nothing to do with what I had said. Stumbled on her words for about 5 minutes, and I just played it off like I was fine. I left early. I sobbed all the way home. I felt so stupid for going. I really like her and I don't want to go anywhere else, but I'm horrible at confrontation. Help. And that was their little sad emoji face. So take a minute and sit with this for just a second. See what comes up for you. If you're completely appalled, if you're horrified because you've done something similar, if you're scared that you're on that slippery slope, if you are super sad for that client, if you are sort of not sure what all this means. We'll come back to this. I'll bring this up a bit, but I just thought it was a really egregious example. I wish it was like never happening and like unheard of, but it's probably quite familiar, something we've seen, something that happens a lot, something maybe we've heard. Tune into what the client is saying about their pain, about how this, without using those words, how this was re-traumatizing for that client. How alone and desperate the client felt that they went to the internet to figure out what to do about this. And how this is a therapist that this client has been working with, and it sounds like things were better and they've gotten worse. So something's going on, right? So what is happening with this therapist? They are not present, that's for sure. And what got them there? How could this happen, right? And so what is therapeutic presence? What do we mean by this? We can say, okay, like I can see that can't, that must mean that's not presence, right? So what else is it? So Geller uses this sort of definition that says a way of being with the client that optimizes the doing of therapy. And I really, really liked that, this idea of being the way we are as the therapist, as the human in this relationship. It really optimizes the therapy, right? The therapy might be the EMDR, the mindfulness, the DBT, the CBT, the narrative exposure, whatever you do, right? Doing that work. But it's the way of being. That's what the therapeutic presence is. It means being grounded in oneself while attuning to the client's moment-to-moment experiences. The therapist is fully in the moment with their entire embodied and regulated self. So some of that language that's from Rebecca Case is related to sort of somatic work and polyvagal theory. And so some of these are things that if you're not super familiar, great areas to read up on, but with your embodied and regulated self. By that means regulated nervous system. Being present to what is going on within oneself, within me, as well as with client, right? So it's not just about really tuning in just to the client. It's about being in tune with self and client at the same time. We are listening with multiple senses, right? Multiple senses. We are using our body as the instrument to tune into our emotions, our physiology, our physical reactions, and our own insights, while we're also noticing that same piece in our clients, right? So this idea that we are maybe even tuning into their physiology. Are we noticing what's going on with them? And when we are really present, we can usually connect to both ourselves and others. And if that's not something we can do, that's what part of today is about, talking about. How do we get better at this? How do we get there? So that gives you a sense of what some of the definitions of therapeutic presence are, right? These are the things. So see if this starts to make sense to you, what this starts to mean to you. And as we talk about therapeutic presence, and I talked about sort of some of the leaders in this field, we are realizing that this is the conversation about therapeutic presence is really rooted in what Jennifer was talking about, this sort of neurobiological concepts, this idea of polyvagal theory, right? This idea of understanding neurobiology and polyvagal theory as we're doing the work. And so there's lots of people who have done sort of the research and then built the clinical practice around this. But, and sort of those are days or years of work to focus on that. What I want the takeaway to be for right now is this idea that when we think about neuroception, it means our nervous system is sort of scanning our environment for cues of safety and danger without us noticing, right? Like it's just doing that work. And so our client's nervous system will be scanning for cues of emotional safety and connection within our sessions. And that their nervous system is scanning to look for the clinician's therapeutic presence or lack of presence, right? Just like that client we just heard in the little example, they were feeling when the therapist was disengaged, the client was feeling something really strong. They were feeling unsafe enough to leave early, flee, cry, right? Sort of really wonder about themselves and the relationship. Okay. And so this is going to happen whether your client wants it or not. Their nervous system is going to be looking to connect with ours, searching for safety and connection, but also searching for danger. So what are they getting from us? What are we giving to them, right? This is our job to give them that safe environment. And so co-regulation is part of this process, right? Part of what's happening in the therapeutic work. It's bi-directional communication between nervous systems of people who are in relationships. So it happens all the time. In fact, this sort of concept comes out of attachment work and child work, right? Infants and children develop the ability to self-soothe and self-regulate and manage distress through safe and attuned connections with nurturing and reliable caregivers, with their parents, with nurturing and sort of attuned moment to moment, right? A cry in a response, a giggle in a response, eye gazes, smiles, hugs, safety, all of those things. So that is how they learn to regulate their own nervous systems, is in response to their parents' soothing voices, eyes, gazes, touch, responsivity. Trauma in childhood or adolescence, as well as sort of like the absence of a regulated and attuned caregiver, will impact our clients' abilities to learn how to regulate themselves, right? So we are thinking about, okay, so Jen said therapeutic presence is really important for clients with trauma. Okay, it's important for everybody. And what we recognize is that when our clients have not had this in childhood or it's been disrupted, it is particularly important that they have therapeutic presence and the opportunity for co-regulation in session. It is a key aspect of trauma responsive treatment where the therapist, we are in this role of co-regulator, right? So we are helping to co-regulate our clients' nervous systems. They're not infants anymore. They may be, 45, 55, 65. And depending on what work they've been able to do, they may or may not have learned co-regulation yet. They may not have learned to self-regulate. They may not have learned to self-soothe. This may be part of what's really, really challenging for them. So the way in which we help co-regulate are things like a warm, grounded presence, our tone of voice, attunement, right? Listening, noticing, being with, validating, modeling behaviors that can modulate arousal. So when we see that our clients are dysregulated, do we match them in tone and get frantic with them? Or do we help them slow down by modeling some breathing, modeling taking a pause, modeling sitting in and grounding ourselves in our seats, changing our voice or our tone or our gaze to help them notice what's going on in their own body. There's other ways, of course, we can invite our clients to notice, right? We can invite our clients to notice some of what's going on in them. So there's lots of other skills that we'll get to in future webinars. But part of what we're doing with just our therapeutic presence is modeling this and being present with our own nervous systems, checking ourselves, right? Am I modeling calmness? Am I helping my client regulate? Am I helping my client tune into what's going on so they can adjust? We can't co-regulate in any effective way without therapeutic presence, right? Clearly that example there, and there's lots of other ways of not being present, right? And we'll talk about those, but the example we gave earlier, there was no co-regulation happening, right? This was a client who felt very alone and very abandoned in their session. That was obvious. Right? So co-regulation, this opportunity for healing, can't happen without presence. I mentioned attunement, right? The attunement, this attuned connection between child and caregiver, child and parent, right? So that when a child cries, their need is met. When they need something, parent knows they need a bottle or a hug versus they need sleep or to be swaddled or a walk or a giggle, right? Attunement within the therapeutic session, when we are attuned and connecting to our clients' needs and their moment by moment shifts, when we're leaning into that, we are better able to notice and read their reactions, their state changes, right? So their emotional reactions, their nervous system state changes when they go from calm to triggered, when they go from sort of fight or flight to collapse. We can notice that and we can respond in a way that helps to build safety, restore safety, right? When there's oopsie moments between us and clients, we can restore that if we notice it. If we don't notice it, there's not going to be a lot of opportunity to fix it. When we think about clients who have not had attuned caregivers, have not learned to self-regulate, have not learned to feel comfortable in safe relationships because they've had trauma, they've had betrayal trauma, attachment trauma, all these things, we can imagine that they're going to be easily dysregulated and reactive to situations where they feel unsafe, or they might even perceive a lack of safety in relationships that are safe, right? This is part and parcel of having experienced a lot of trauma. So clients with trauma histories are going to be extra sensitive to therapists who are not present. And the meaning they make of that is not necessarily going to be neutral. My therapist is having a bad day or something's up. It's going to be, either my therapist is not safe, she's dangerous, or there's something wrong with me. There's something wrong with me that is keeping my therapist from wanting to be with me, from being interested in, from caring about me anymore, right? So it's really understand, this is part and parcel of what trauma work means. So in order for us to be able to be attuned and be present and notice our clients' needs and respond to them within session, we really have to be able to be present and attuned. And the need is greater for clients who have had histories of trauma and a lack of attunement. I mean, think about this, right? Like, all clients deserve this. Anybody receiving our services deserves this. This is like the bare minimum, and particularly clients who have never gotten it elsewhere and have been really harmed by the absence of presence and safety and connection in their other relationships. So what does therapeutic presence look, sound, and feel like, right? What is this thing that we're trying to cultivate? So for me, I don't know, I love the earth, I love stones, I love rocks. So this feels really symbolic to me. That may not be your image. So you can start to cultivate your own image, the image that feels like this to you. But we'll start with, what does it look like to the client? The client is experiencing it. What might they be noticing? Certainly you're going to notice when you're texting, right? They're going to notice your gaze. Is your gaze present, focused, and tracking the conversation, right? Are you with them? Is your gaze showing them that you're there? I think all of us know, all of us, because of cell phones, know what it's like for people to completely disregard us in our personal lives and family lives. Any of you raising teenagers might feel the lack of presence a lot when our children are tuning you out. Good news is their job is not to raise us, right? Our job is to raise them. And in the sense of our clients, right? Like, so this idea of what does it feel like? Ooh, it doesn't feel good. So our gaze, who we're attending to, right? With our eyes, and then our facial expressions are going to sort of be what our clients are noticing. Is our facial expression mirroring the client experience, right? Do they see that we get them from our facial experience, right? Our facial expression. Are we sort of like, when we're mindless, we're smiling and they've just recounted something really sad, or we're still sad, but they've moved on and we're thinking about something else. So we're still with this sad face that does not match, does not align, right? Are we conveying this attunement, this connection, this presence with them in the face, in the smile, in the nod, in the nonverbals, right? What are they getting from us, just from our facial expressions? What about our body language? What does our posture convey, right? Does it convey the engagement and connection that we want it to? What about some of you who do fit, sort of in-person work? How do you sit? What are your hands doing? What are your feet doing? What does your body look like when you're present with a client? And there's no cookie cutter answer, right? Like, there is no one way to be. We are really sort of what does embodiment and full presence look like for me, so that my client is picking up on the fact that I am comfortable and grounded in my physical space, and my client can see and feel that, right? Just tuning into what that looks like. It doesn't mean you're sitting straight up like this every time, or that you have to be leaning in. What does it look and feel like? What to you? Maybe look at yourself in the mirror sometime and look at what it looks like. Are our faces and bodies and movements conveying that we're awake and interested, that we're tired and bored? They're antsy and anxious. Are you fidgeting with your finger? Are you picking? Are you twisting your ring over and over and over? Are you flailing around? I do that sometimes when I do trainings. I notice I get excited and I touch things. I really try to be careful not to do that when I am in a client session. Am I focused and compassionate, right? What is it like? Tapping my foot, ready to get out the door, ready to run. Like, what am I conveying with my body language, what's going on with me, because my clients are feeling that, seeing that, sensing that. And because so many of us, including myself, do a lot of virtual work, we don't often have our full bodies to be present with. So what does that mean? Have we thought about how to convey presence carefully and intentionally when our clients can only see parts of us? What does that mean we're doing with the rest of ourselves? Do we think because they can't see it that they're not experiencing it or they're not noticing? So really tuning into what that looks like. Starting to think about, yeah, like what does therapeutic presence look like to me? What are the facial expressions that resonate for me? Sometimes when you do Zoom, you can see your own face and you can get a sense of, me and my clients, is there mirroring going on? Is there resonance? Do we seem connected? Sometimes that's could be a plus of virtual work when you can see sort of both things happening, because other times you don't actually know what you look like when you're doing therapy and you don't know what your face is saying. What does therapeutic presence sound like? Okay. What's my verbal tone, the pitch? Are they matching the client's emotional state? If I'm noticing that my client is real revved up and I notice I've actually started to rev up with them, I might sort of notice that and then help to sort of slow us both down as part of the co-regulation, right? Am I using a tone that sort of feels like I'm really, really present and connected? Are my responses timely and not lagging behind, right? Like I think the client in that example, and it's funny, I pulled that example and had it, sort of after I had done a lot of the presentation. And it's just so funny with that person, funny, sad, was describing all these things. And just in that one sort of post, so many different things were evident. The responses were not timely, right? Their therapist was not responding. It was like, oh, hello, just rejoined you in this session. Not only that, but the reflections that the therapist made were not at all resonating with what the client said. The client was like, "No, that's crazy." And the client was like, "Well, nothing I said was just crazy. That doesn't land." Right. So we're really the poor use of reflections and then reflecting, like sort of parroting the last thing the client said versus a really thoughtful, intentional response that you can only get. Years of experience doesn't matter. You can only get that from being really fully present and attuned to your client in each session and in that session. That's when you can feel, and you will know, right? A lot of times I'll sort of be talking to a client and ask them sort of, what did that feel like? Or what was the feeling that came up for you? And when they say it, it's exactly what I felt like they were going to say. Like I had the exact word and not something like happy, but a nuanced word. And it's because we were in sync. I felt what my client was feeling. I sensed it, right? I don't read their minds, but we're sensing it, right? I'm really present with them. And then silence, right? Silence is not a response that's lagging behind the client. That's not silence. That's a oopsie. Silence is when we're really sort of present and we can recognize that this is a time to pause, a time to let the client reflect, a time to let the client ground, that we're using this silence in a really strategic and intentional way. Because we get the sense that this is what the client needs, or this is what the session needs right now. What does therapeutic presence feel like? What does it feel like in all the ways? So this was an image that for me, just, I don't know, at this phase of my life, I'm really into like cozy things like blankets and soft blankets of every sort, and like cozy socks and just cozy things, right? That has something to do with getting to work from home. We can be cozy, and I've come to appreciate that, right? So cozy blankets, and I don't know, I think that might be tea, but I'm a coffee drinker, so I'm going to pretend it's an espresso. And it's just this warm, sort of warm cup of coffee and this amazing warm candle and this cozy feeling. So what does it feel like? Feels like being seen, heard, understood, and cared for. Feels like being connected and attuned to. Feels like having my nervous system be in a safe, calm state. Feels like being in relationship. And it feels like many other things too. And so what I ask of you all You see my little nod to coffee again. What I'll ask for you all is if you would close your eyes. I'm not sure where you are, but if you feel comfortable closing your eyes or just like putting your gaze downward so you can actually reflect inward. What I really want you to do is to sort of take a moment to reflect inward. And I want you to think about, sort of call up an experience of presence that you've had, either as the client or as a therapist or as another human in connection with someone who was present for you. As you call up this memory of either being fully present or receiving the full presence of your therapist or another caring human, I want you to just take a moment and take note, tune into what this felt like for you emotionally, physically in your body, physiologically, in your nervous system, in your heart, belly space, what it felt like relationally to you. I'm going to give you a few seconds to do this in silence. I want you to really notice this and soak in this recollection and this feeling. This is what we're trying to cultivate. This is what you're cultivating. It might feel a little different to each of you, but this is what we're trying to cultivate. So if it's you having been present for someone, you're cultivating more of that. If it's someone having been really present for you, you're beginning to create that and bring that to the sessions that you have. So what can occur when we're present? So you just got that feeling. So, I mean, the first thing that occurs is like a really good feeling, right? This sort of safe, cozy feeling, right? It's an emotionally safe environment where the client can feel seen, heard, and understood. Within these conditions, clients can begin to expand their window of tolerance, right? So they can build their capacity to notice their own feelings without judgment, without fear, within a safe setting, so they can begin to self-regulate. What else occurs? Better attunement. We are looking for attunement in this work. And when we are able to be fully present, that's when we can get the attunement, which means we're noticing these moment-to-moment shifts in our clients. When we are noticing that, we can actually reflect on these shifts in the clients in the moment so that they can build that self-awareness. They can notice when they tensed up or when they collapsed or when they got antsy, or start to notice the tears and what those meant, or link things, right? They're building that self-awareness. We are helping. When we are attuned, we can use our skills, like, think about a list of therapeutic skills. We can use them effectively when we are attuned. Our reflections, our interventions, whatever those are, reflections, comments, acknowledgements, those are going to land. They are going to land because they are much more accurate. And when they land, our clients build their self-awareness. They start to understand themselves and their needs better, right? When they understand themselves and their needs, they can begin to meet their needs. They can begin to heal. So when we have this opportunity, when we have this presence, right? This is, again, back to Geller's, it is a way of being with clients that sort of optimizes the doing of therapy, right? This is allowing the therapy that we're doing to really land. And clearly, sometimes we struggle. We are human instruments, right? We are human. We're going to struggle. There's no such thing as a perfect parent, certainly no such thing as a perfect therapist, right? Hopefully we are all at that place in our lives where we recognize that, if nothing else, perfection is not an option, doesn't exist. And so we're going to struggle. And even that therapist that was doing that possibly good intentioned, but really, really falling short of good practice with their client, something happened. They were struggling to be fully present with their client. Sounds like it had gotten worse over time. So how? How does that happen? How do we notice that? Like what's going on? Well, things we can notice. So think like which of us, right, at every moment of every day has like a clear mind with only sort of the present moment. I don't know if any of you are Buddha, let me know, but the rest of us probably look like this fella sometime, right? Like there's this stuff going on, right? And so what we might notice is our mind is wandering instead of listening to the client. Are we, there's this little person ordering their Uber Eats, right? Are they, grocery list, planning to do, shopping at Free People in my mind? I don't know, right? Am I thinking about my own issues? Clients mentioning something and somehow it becomes about me, and now I'm thinking about my life and my issues and am I just giving in to urges to check it again? Somehow I feel a vibration or I see a ding or I'm wondering about a text message. I'm allowing myself to check a text message, check an email, respond, text incessantly. Like what's happening? Am I lapsing into multitasking? Am I noticing that somehow I was taking a note on a client and then I got into jotting down something else? Am I checking the clock or watch over and over? Have I gotten into a habit of checking the time? I'm antsy to leave, and so I'm just wanting this to be over. Am I exhausted and just so not present that I'm falling asleep and I'm really disengaged and I'm dissociating. I'm sleepy, I'm yawning, I'm going somewhere else, I'm disconnecting during my sessions. Am I so agitated that I'm restless? I'm hyper, I'm fidgeting, I'm tapping, picking, moving, scooting, right? Am I having a lot of anxiety that I'm noticing? My heart's racing. I'm noticing my nervous system won't calm down. Am I getting really emotional? Like, am I sort of losing it every time a client brings up something sad or painful or scary or what's happening? What am I notice, right? Like I'm not present with my client. I'm getting sucked into past, future, all kinds of things, right? These are all kinds of ways that we can struggle to be fully present, right? Some is the obvious sort of blatant, I'm texting or I'm emailing or I'm multitasking, but others are, I am unable to be present with my client because I'm really sucked into my own emotions. I'm dissociating. I'm going offline in my own ways. I'm not in my own window of tolerance, right? So those are the signs I want to tune into. So I'm going to ask you all again to reflect for a minute. If you'd please just close your eyes and think about maybe your most recent sessions, maybe this week, maybe last week. What are some of the things that have been pulling you out of the present moment? Sort of close your eyes again and just sort of reflect and dare to be really honest with yourself about what was getting in the way, right? Dare to be honest with yourself about what was pulling you out of the present moment. So think about these with your eyes closed, just pull up. You're human. You're here to fix this, but just notice what's been pulling you out. Maybe it's some of those things that we just mentioned before. Maybe it's other things. But now that you're noticing, you're bringing these barriers, your own barriers to presence into your consciousness, take a minute and jot them down. Grab a Post-it, write something down, jot down a couple words that remind you, like what's been happening to you. Anxiety, dysregulation, boredom, sleepiness, what's going on? When you're aware of them, and not until, right? If you're not aware, you certainly aren't going to be able to do anything about them. So jot these down so that you are aware so that we can do something about them, right? Once you're aware, you can make this change. So please jot them down, take the step of sort of being honest with yourself about what's been going on with you. And you've noticed, yeah, you're human. There's things getting in the way. You've had some oopsie moments, maybe a lot more than usual, maybe a lot less, but something's getting in the way. Why? What gets in the way? Well, a ton of things. Burnout and compassion fatigue, right? Sometimes that's because we see such hard things and we do such hard things. Sometimes it's because we're seeing client after client, maybe, right? we are maybe having overscheduling ourselves, or maybe our job is, or maybe we just see clients with so much pain, right? Vicarious trauma, it's wearing on us. What about our unaddressed mental health needs, right? Sometimes we somehow pretend that other people need therapy, but we don't. Not true, right? The healers also need to be healed, right? So we need to take care of this. Are we doing it? It's like whack-a-mole. If we don't do it, it's going to come out where and when it wants. And that's going to be in session sometimes when our clients really need us to be present. Could it be, some of you might be new. I mean, some of you are new. I know by some of the emails that you are BSW students or MSW students or early in your career. Self-doubt, imposter syndrome, those things are real. Lots of us, I think, the more we do some new things, and I've talked to some of our doctoral students, like you start something new, you've been confident for 20 years, then you do something new, and all of a sudden all the old stuff comes up. All of us are, maybe it's self-doubt, some trying a new intervention, EMDR for the first time, or this is a new in my wheelhouse. So what's getting on? Am I here in my head instead of with my client, worrying about me, trying to be out in front of everything that comes out of my mouth, or am I present? Pressure for results. Maybe it's from someone else, our clients, their parents, our boss, a principal, a teacher, I don't know, whoever else we're working with, right? Maybe it's just our own sort of dogged nature. Maybe we're challenged to trust the process. We're scared to trust the process. Maybe we have an unmet need for supervision or consultation. So those of you who are already licensed, you did that, and then did you ever get consultation again? Do you use supervision? Because it's great. Supervision and consultation are amazing, and we need it. And trying to find ways to make sure we engage in our community and build our community of trauma practitioners, because we need to do this sometimes. Ethical practice drift. I think that can mean lots of things. In this case, it's this sort of, somehow I had a line where I would never cross, which was like, I'd never text in session, and somehow I'm doing it. Or maybe I'd text once and now I'm having full texts. Or I might text, but I'd never scroll the internet. And like, right, what's happening? Where did all these things become okay when I know that that's not okay? Like, what happened here? Sometimes it's need for better self-care. And by self-care, I do mean things like a big, amazing vacation or a spa day, but mostly not. Mostly, I mean, just day-to-day ways that we're tuning in to what we need to be able to be present in our lives, the way we need to sort of be in our own windows of tolerance. So maybe that's, are we not getting enough sleep? Are we really overscheduled? Are we failing to make time for food or snacks or hydration? Are we giving ourselves a break? Do we ever get exercise or opportunities to take care of our bodies, right? Our bodies that are sitting a lot. If we are doing this, are we doing these things? Are we learning what we need to self-regulate and self-soothe? So all of these things are options of what might get in the way for us. Really common, right? Of course. And what are the risks of sort of allowing these things to go on uninterrupted? We fail to create a therapeutically safe environment. We inadvertently send a message that the client is not important, boring, irrelevant, a burden, not worthy of our time, not cared about, too much, too little, all the things, right? And these messages, if any of you do this work and think about core cognitions or core beliefs, right? Unhelpful beliefs, these messages that we're sending inadvertently by sort of not being present may be really similar to messages that are internalized during the original trauma, during relational trauma, during really troubling relationships. They're going to send alarm signals to our clients' nervous systems. They are going to feel that trauma again. They're going to feel right back where they were, feeling irrelevant, not enough, not okay, not safe. They will enter, instead of being present for the therapeutic work and healing, they'll be in a state of fight, flight, freeze, flop, right? There's the potential for re-traumatization, everything we are trying to avoid. And so we really want to think, there are big risks, right? Like there is a risk, like this is an important thing to address. We really believe that. And here's just a couple examples, right? Of more, right? So when we're in virtual therapy, is the risk greater to lean into this? Here's one. My therapist at times seemed distracted during virtual sessions, reading something, looking at her phone perhaps. Am I wrong to be upset by this? Does it mean she is horrible, bad, or dishonest? Dislikes me? So this is a client just trying to figure out, what meaning do I make of this? And I either believe my therapist is unsafe and this is not a safe place to heal, or I start to internalize it and I believe I'm not worthy, I'm unlikable. The next one is not from the internet, but it's from someone I know who went through this. My therapist was yawning a lot during our virtual therapy sessions. I felt like I was boring her or like my problems were insignificant. It made me question whether I was wasting her time and mine. I felt really bad and didn't want to go to my next session. I ended up dropping out. And this is a person who really was going through something big, and a person who, of course, often feels I'm not interesting enough. I don't matter that much. Other people are much more interesting than me. So their therapist yawning and yawning and yawning and never addressing it. This person was left to believe, must be me. She doesn't like me. She isn't interested. And there was no opportunity to heal and grow. So what do we need? What are the characteristics for secure and healthy therapeutic relationships? We talked about the nonverbal attunement, right? We talked about that a lot. That's an important one. Spacious, grounded attunement is another one. It's this idea of not just showing it, but actually being really able to be attuned, having the capacity to be fully present with a client going through something really difficult. So they can feel safe and confident in the process that we can hold anything there, right? We can be present without being overwhelmed by their trauma narrative, by their tears, by their yelling, by their shaking, right? We can be there and with them. We can't do that without being present and comfortable in our own nervous system. The ability to sense signals from my own body, noticing and listening to and understanding what we're feeling. This is an example for me of a client. My client that I was working often does this, a laughing thing, but I feel this really strong sense in my core that this laughter feels awful to me. It feels so uncomfortable. And it is this strong sense that this laughter is super painful. It is masking terrible pain in my client. And it is something that I had to really listen to my nervous system to be able to see that what my client is sharing with me is not what's underneath. And we were able to explore it and tune into it and begin to work with it bit by bit, because there was something that I was noticing that felt so terribly off. And it was a real felt sense rather than something that I was just sure of. Capacity for intimacy and to hold pain, terror, and hope. We have to be able to hold all the big stuff and simultaneously be with our clients in the depths and not get so overwhelmed and dysregulated that we don't have the hope. We need the hope still. We absolutely need to be able to hold that when our clients can't. We need to be able to embody a stance of non-judgmental curiosity and unconditional positive regard and share that with our clients so they feel that safety regardless of what they're talking about, doing, saying, reacting to. And then we need the skills to repair therapeutic ruptures, right? We need those skills. So what are the steps to become therapeutically present in our daily lives? So it's not just in the moment, it's in our lives. What can we do? Yoga, mindfulness, self-care to build our window of tolerance. The preparation phase, a lot of times folks will think about preparation like getting to my client. It also is about taking 5 minutes to get centered, stretch, do breath work, establish an intention for presence before your session. Within the session, it means tuning into your feelings as well as your client's feelings. Noticing your breathing, modulating it, all the things we just talked about for the last 45 minutes. And then after sessions or between sessions, giving yourself that minute. Don't race in, switch, breathe in and out, shake it out, whatever you need to do to be able to let go of the work with one client and be fully present for your next. And so I'll just give you an example. For me, I have taken up yoga and I've done it off and on my last 20 years, but for the last 2.5 years, it has become sort of everything for me. And so I have integrated yoga into my daily life because it allows me to be much more present in my body, in my nervous system, more conscious of my breathing. I am a fast talker, fast mover, fast thinker, intense, and that's not always helpful. So I need to temper that. And yoga is a really helpful way for me to do that. And this is a picture of me doing yoga in Sedona. And Sedona is my happy place. It is my grounding place. So this is sort of an example of what I use both within sessions, before sessions, either yoga or yogic breathing or grounding in this centered space to be able to have the capacity to be more with my clients. And I want to turn it over to Jennifer for a moment so she can share what works for her and what her picture symbolizes.
Yeah, thanks. My picture symbolizes connection, meditation, uh, presence. I think for, when you talk about therapeutic presence, Ashley, it's so important that we recognize all of the other components that go along with it. And I'm realizing as you're going through that, that a lot has to do with what I do in my daily life. And I work very hard. I'm not always good at it, but I work very hard at living what I preach. And that has to do with self-care. I surround myself with colleagues who I admire and respect and also have similar beliefs with the work. I engage in a lot of laughter and I make sure that I watch things and listen to music and try to enjoy some things that bring a little oxytocin into my life to balance the cortisol. And then the other piece of it too is that I won't take so many clients a week. There is a certain amount that I know that I can handle with all of the responsibilities as a professor, as a parent, as a wife. And I really try to stay with that. The last thing I want to say in terms of therapeutic presence in the session, what that looks like, I also have a routine. The night before I see my clients, I take a look. I have a little meditation and prayer that I go through, ask to be guided to what's best to connect with them. It's just something that I do. I have a routine in between clients where I will metaphorically, I just think of an image of closing up the previous one. And then I'll actually go to the restroom, wash my hands a little bit and just shift that off and then open myself up and move into the next one. I've been doing it for so many years that I just need a few seconds to be able to do that. And my body knows then to shift. Um, there was a question, and I know folks aren't going to be able to get to all of your questions, but there was one where she was talking about the co-responsibility in the therapeutic relationship and owning that we're humans too, and absolutely we're human. Of course we are, and there is no perfect, right? Of course we create a safe container and we help to work with that. But I think we always have to be cognizant of what our container is and recognize and be okay that no matter how much experience we have, no matter how many credentials we have, what I find to be the most powerful and that I would go to a therapist over any credentialed experienced person is one that can sit and hold presence and sit here with me and be here with me. And if it's like Deb Dana says, if you're just not able to do it, then you acknowledge it, you get in and you get out. And you make sure that you're just being there with them.
Thank you, Jennifer. That's really, really, really helpful. I love those examples. I know that you do live that. That is exactly how you work, and it's really helpful and a really nice model for me. So what I'll ask all of you, right, is to think about these things. You can take a picture of the screen. Maybe you already remember these things, but really give yourself some time to think about how you will be more therapeutically present, right? We're human, we're going to make mistakes, but it's our job as therapists to take care of ourselves so we can be present for our clients. So, sort of answer each of these questions for yourself. I challenge you to do that today, this evening, before your next session. Really think about, what are you going to work toward? Jen gave you some examples. I gave you some examples. There's a lot in the resource list that you'll get, but really start to think about what this will look like for you. Make this your little activity. Here is the upcoming slide. Jennifer, Dr. Williams, you'll get to hear a lot more about her work and her polyvagal theory experience and how this shows up in her practice and the way she lives her life in her session on window of tolerance. So we'll be doing that in September. So we're going to skip August, and this will be September 18th. And lastly, I just want to thank everybody so very much for being here. Again, scan this again. Remember to go there. This is going to be posted in a week. So will the tip sheet, which is really all about those strategies, as will the resource list with tons of amazing readings. Some of them are free to access, some are books. But we deeply appreciate you. Have a wonderful day, and thanks everybody for joining.